The study from researchers at the BC Centre for Disease Control paints two pictures. The first is BC's relative success at limiting the spread of COVID-19.
All British Columbians should see themselves in this very positive study, the first really of its kind in Canada.
I'm heartened by the results in that it shows that we are doing a good job, or have done a good job over the past few months at reducing the community burden of infections.
Dr. Srinivas Murthy didn't conduct the study, but is a COVID investigator for the World Health Organization. The research finds less than 1% of BCers had COVID antibodies or had the disease. The data comes from serology testing back in May, meaning efforts to stop the spread overall worked quite well. Measures like wearing masks, closing down facilities, and limiting public gatherings.
What it does show is the efforts of communities of flattening the curve that all British Columbians took part in that have been extraordinarily successful.
But health officials agree that success is a double-edged sword. Because there have been so few cases in BC, that means there's little immunity in the general population. And that could have big effects in the fall if there is a second wave.
If there is, for example, a community spread of infection, there will be a large number of people who are susceptible to it.
So don't expect physical distancing guidelines to relax anytime soon, especially with new data confirmed by the study.
There are more people who were infected with COVID-19 than tested positive, and that's something we said clearly.
About 8 times as many people had COVID than tested positive for it, the data suggests. So those community cases are out there. As for whether the low rates are going to change reopening plans in BC,
we're constantly assessing the evidence.
No clear word from health officials just yet. Micki Cowan, CBC News, Vancouver.